Good afternoon. Today we are discussing about the astrology of femur. The femur. In the introduction of femur, that is the otherwise name known as the thigh bone. It is the longest and the strongest bone in the body. It has the three parts. There have the upper end, lower end, and the shaft. The upper end. We want to know about the upper end. The upper end we are present with the head, neck, greater trochanter, and the lesser trochanter. The head, they have the half sphere of the articulated with the acetabulum of forming the hip joint. The near of the center they have the head. So is the small pit that is known as the fovea. The where is the fovea? Present the ligament of the head to head of femur is attached with the acetabulum. Neck is connected the head to the shaft. The connected with the head and shaft with the angle about the 125 degree. The neck. After that, they know about the greater trochanter. It's the quadrangular projection from the upper end, the upper end of the shaft. The greater trochanter has the rough lateral surface, the anterior surface, medial surface, and the upper end, which is the apex and the posterior border. The lower part of the medial surface is deeper and the trochanteric fossa. There is many muscles they are attached to the trochanter. To the lateral surface, there have the lateral surface. They have the gluteus medius. The anterior surface that they have present the gluteus minimus. The apex, they have the piriformis. The medial surface, they have obturator introsus with the two gemelli and the trochanteric fossa. After coming to the shaft, there have the smooth and rough for the anterior. After the posterior surface present with the ridged that medial and lateral lips. The line of aspera, which may be the muscle attachment. The medial lips is connecting above the rough line, the spiral line, which is reaches up to the intertrochanteric line. The lateral lips is connected continuous about the rough line of the rough. The gluteal tuberosity, which is rounded up the root of greater trochanter. After that, lower end. The lower end presents with the two large mass, the medial and lateral condyle. The lateral condyle is lesser prominent and the medial, but the strong and the stouter. It's more is the line of the shaft as the more raw transmission of the weight to the tibia. The project separately posteriorly and for the untied anteriorly. They together have the broader shaped V-shaped articular surface. The upper part of the articulation surface, there have the patella, and the lower part for the condyles of the tibia. The in between the gap between the two condyles posteriorly, that is called the intercondylar fossa. The most prominent point of the medial surface, the medial condyle have the medial epicondyle. That is the uppermost part of the surface shows the adductus tubercle, which is tendon of adductus magnus. The most prominent portion, lateral surface of the lateral condyle and lateral epicondyle. Below it's the groove, the popliteal groove from the popliteal region. The attach the muscle of the femur that shows the there have the ossification, the secondary longest bone of the ossification head of as the ossification. The primary center, the shaft is 7th week in the uterine life. The second center, lower end of head, that is the 9th month of the uterine life. The head, 1st to 6 months after birth. The greater trochanter is the 4th year. The lesser trochanter is the 13th year. This is the proximal third of the closer head of or the cranial end of the body. The medial third of the shaft. The distal third towards the feet are the caudal of the end of the body. The anterior view and posterior view also showing. The head. This is the head of the femur and the anterior view and the posterior view. They are same like the anterior view and the posterior view of the neck of the femur. After that, the greater trochanter for the anterior view and posterior view. Same like the you are showing the lesser trochanter also lateral, anterior and posterior view. There have the intertrochanteric line, that is the anteriorly view only presents. The hip joint capsules attached to the anteriorly. At the posterior view, the intertrochanteric. This is the pit for the head. The fovea, this is known as the fovea, provide attachment with the ligamentum tira. The ligament of the head of the femur is attached with the acetabulum to the pelvis to help the stabilization of the hip joint. After that, we have the pectoral line, that shaft present with the femur, the posterior view. That is only for the pectoral line. The shaft of the femur, the posterior, they have the gluteal tuberosity. They attach to the gluteal muscles. After that, the posterior view, shaft of the posterior view, they present with the line of aspera. After the shaft of the femur, the lower have the medial supracondylar line. The same like the shaft of the femur, the posterior, they have the lateral supracondylar line for the ridge. Okay. There is the distal, the medial condyle and the lateral condyle. They we have to know about this. After the distal of the femur, they attach with the medial epicondyle. They are attached with the adductor tubercle and the lateral epicondyle. There is a separation with the in between these two condyles. There is the intercondylar fossa or the intercondylar notch. They have the anterior with the medial condyle and the lateral condyle. The proximal femur, the anterior view, they have the piriformis muscle attachments. The incision of the piriformis, the arising from the anterior aspect of the sacrum and the passes throughout the greater sciatic foramen before the incision and the superior and the medial aspect of the greater tubercle. The external rotation and the stabilization of the hip joint. After the gluteus minimus, the minimus, they origin from the outer surface of the ilium and the insertion into the anterior surface of the greater trochanter. It's the function of this gluteus minimus, the adduction and the internally rotated the hip joint. After the iliacus muscle, the iliacus muscle is originated from the inner aspect of the ilium, the insertion for the lesser trochanter. Then after that, psoas major, the origin from the anterior surface and the lower border of the transverse process of the L4 to the L4, L1, L2, L3 and the L5, and the lateral aspect of the body of the disc between the T12 and the L5. There we insertion to the lesser trochanter. The vastus medialis. The vastus medialis also originated from the lower aspect of the intertrochanteric line and the medial line of aspera and the medial intermuscular septum. The vastus medialis, one of the four quadriceps muscles, is attached the patella to the medial aspect of the quadriceps tendon and attached to the tubercle of the tibia. The vastus lateralis, their muscle is extended to the attaching of the upper intertrochanteric line, the base of the greater trochanter and lateral line aspera, the lateral supracondylar ridge, thus lateral intermuscular septum. It's attached to the patella with the lateral aspect of the quadriceps tendon and the tubercle of the tibia. It's extended into the knee. Vastus intermedialis, the one of the four quadriceps muscles, they originated from the superior two-thirds of the anterior and lateral surface of the femur. The insertion into the other quadriceps muscles into the patella and onto the tubercle of the tibia. Obturator introseous. The obturator introseous surface is the obturator membrane of the posterior bony margin of the abductor of foramen. The incision into the medial aspect of the greater tubercle. The abductor extends the origin from the outer surface of the abductor membrane and the posterior bony margin of the abductor foramen. The incision into the tubercle fossa and the medial aspect of the greater trochanter. This is the attachment. This is the ossification and the attachments of the bone muscles of the femur bone. Thank you.